Hey guys. Oh, I want to introduce you to Lucy. Have a seat, Judy. Thanks for joining me today. We are talking about melasma. By the way, I'm happy you met my dog, Lucy. She's usually passed out on the ground, but she's always a staple in my videos, just chilling in the background. Anyways, melasma, I'm going to talk about prevention. What the heck is it? And my treatments for it. Stay tuned, it's a good one. Okay, melasma. Basically, melasma are these patches of dark spots that happen on your face. It usually happens in women, but men also have it. And it usually shows up in these dark patches that are commonly found on the upper lip, the cheek, the nose, or the forehead. The difference between melasma and sunspots are like melasma just shows up randomly very quickly and it'll just happen in these large patches. Where with sunspots, it looks identical. However, it starts as a freckle and then it gradually grows a little bit bigger over time. And then that can happen at some isolated areas, but it doesn't happen in that patch form that we usually see with melasma. So what causes it? Well, sun plays an influence because it's only found on areas that are exposed to the sun often. So like your arms, your hands, and your face. But it's usually a genetic disorder. So if your mom had it, you're likely going to get it. Hormones do play a big factor as well. If you're on birth control, that can cause it. If you're pregnant, you can get it then. It's actually called a pregnancy mask, and usually several years after pregnancy, it can just happen. Okay, so now that I told you the bad news, is there anything you can do to prevent it? Yes. Use UVA, UVB protection, SPF 30+. What that'll do is, like I mentioned, all the areas that are exposed to the sun usually are activated, so you're gonna block that. SPF 30 blocks 97%. Once you get 45 and 50, then you're blocking even more, so more the merrier. Now, like I said, it's a genetic and hormonal issue, so it's going to come out regardless. What can you do? If you're at a young age and you don't have any issues with melasma yet, you think it's a possibility because someone in your immediate family history has it, start using retinol. I'm going to get into all that at the end. Retin-A is the way to prevent getting melasma. Yay. Okay, now for the treatment of melasma. You have it, it sucks, it showed up, what do you do? Fill me in, Dan, fix me, buddy. First up, laser treatment. Laser treatment, nowadays you can find great lasers that can get rid of it within like a month or two max. Usually one treatment, you're gonna see significant results. In 2 treatments, it's gone. But it's pretty expensive, it usually costs like $2,000 a treatment. If you can afford it, go for it. Next, my next recommendation is a form of microneedling with PRP in combination with topical products. So why microneedling? Well, there's a lot of new studies out there and they're showing some promise with it. What it does is it gives you access to the dermis. Now before I go further, you should know that melanocytes dictate the color of our skin. And with melasma, those melanocytes produce too much color. And these cells can be found in the 2 layers of our skin, epidermis and dermis. Basically aerating that area and putting your PRP, which is platelet-rich plasma, right to the area, and it's going to heal any damage that's done. That in combination of putting products on your skin in order to help rejuvenation and also help inhibit or stop the production of melanocytes is a perfect combination in my opinion, and I've seen some nice results with it. Now let's go for the creams. Your gold standard cream that's going to treat your hyperpigmentation for melasma is going to be something called Hydroquinone. Hydroquinone 4%, that's what I recommend, twice a day, and you're going to use it as a spot treatment on the areas. At that point, you can expect to see full results by about 3 months on average, maybe up to 4. So the 3 other products that I recommend that are coming in as a close second are basically azelaic acid, your kojic acid, and your arbutin. Now there are a bunch of other natural products out there that all inhibit the production of melanin. So you're looking for something that's called a tyrosinase inhibitor. And tyrosinase is the enzyme that basically stimulates the production of melanin. Unfortunately with melasma, it's a hormonal issue, right? So if you treat it and it goes away, it's going to come back. So what can we do in order to prevent it from coming back? And that is the retinol. The retinol is basically your secret. So the benefit of retinol, it is naturally acidic. It's not a very strong acid, which is the reason why you can put it on every day. However, that slight acidic property, guess what? It's going to inhibit the production of tyrosinase just enough for you to be used on its own actually for a treatment for melasma. The problem is with it, it takes a long time. It's going to take at least 26 weeks for you to notice any difference if it's used on its own. What we do is we use that in conjunction, and at the same time, once your melasma is treated with either your hydroquinone or your arbutin or whatever you use, continue using your Retin-A and it'll prevent it from coming back. It's the most studied skin cream to this day. There's over 30 years of research on it and it's all positive. And lastly, a physical SPF with 30 plus. And that is it, my people. Okay, so before I go, I just want to let you know, I didn't talk about all the skin products out there that could potentially help with melasma. There are a bunch of others that enhance the effect, such as vitamin C, or copper peptides, or matrix formulas, or niacin. Oh my gosh, I can go on. However, I don't recommend usually people putting 5 to 7 products on their face twice a day because it's not realistic. I approach this as if this were a family member of mine asking me for help. I know that I can get away with maybe 2 products max with an SPF or plus SPF, and they'd be very happy with that. So that's my approach. 1 or 2 products plus SPF in the morning, 2 products at night. Very doable. I think you'll be really happy with the results. So this is me signing off. Do me a huge favor. Like, comment, and subscribe. Post any comments you want. Whatever videos you want to see in the future, I'm more than happy to help you out. Before I go, I'm going to show you my dog. Bye guys.